In the modern day hectic life, where stress and strain has become a part of life, can yoga provide a respite? Dr. R. Nagaratna, who is basically a medical doctor, MBBS, MD, MRCP from UK and FICA from America, and involved since 1979 in the field of yoga, tries to provide an answer to this question. She is also a Chief Medical Officer in Vivekananda Kendra Yoga Research Center in Bangalore.
Is there any relation between science and yoga?
Yes, certainly. Yoga is also a science. Science also has been looking for the same answers. If we look at what exactly the scientists have been pursuing their interest in, the basic sciences at least, like mathematics, physics, etc., and also in medical sciences, we are trying to look for what is the most basic fundamental unit of this universe. And exactly a similar question has also been asked by yogis. In fact, it's very interesting to see how exactly same question is asked. There is one Upanishad called Taittiriya Upanishad, where the student goes to his teacher and asks, what is the truth in this universe? And then the teacher says, you go and search for it, you make experiments, you go on finding out from where the whole universe has come from. And this is a very basic fundamental question that is common to both science and yoga.
But the difference in the two has been that when a scientist asks this question, he starts looking outside for the answer. So, he starts picking up things from outside, that is the physical world, broken into smaller and smaller particles to find what is the basic small unit. So, it became a journey from atom to quantum and so on. On the other hand, the yogis looked within own self and tried to analyze the mind to get at the root of the basis of the universe. And that is how both science and yoga have come to a one meeting point.
I was in Cambridge when I met Professor Josephson, who was the youngest Nobel Prize physicist. And in his lab, we were all very curious to see that there may be lots and lots of gadgets in which he is doing research. But when we went to his lab, it was a small place with lots and lots of books like Upanishads, Veda books, etc., which he is studying and then turning the mind inwards, closing his mind and trying to validate what is given in the books. And that way he is able to move ahead in physics, he says, because the next line, next direction for science is also to analyze the mind, understand the mind, master the mind, move ahead to get more and more understanding about the mind. And that's what yoga is all about.
Is this yoga effective in this modern concept?
In fact, that is exactly what was a great renaissance that Swami Vivekananda brought about.
About 100 years ago, Swami Vivekananda sat and learnt his knowledge. Being a modern educated young man with a British training, he went through the Indian methodologies, yoga, Vedanta and philosophies. He got through by sitting at the feet of Sri Ramakrishna and learning. When he wanted to see relevance of yoga, he found that the modern man needs yoga in all its aspects. And it is analyzing and understanding the mind, making it relevant to modern science is the important work that he wanted to carry out.
How relevant yoga is for all walks of life in the society, starting from baby in the womb, we call it Abhimanyu Yoga. Baby in the womb, right up to the person in the deathbed, the terminally sick, all walks of life, children, housewives, professionals, everybody, we try and see how yoga can be of value.
Can you give us some details about in which field you are in and what work you have done in?
In Vivekananda Kendra, the Yoga Research Foundation, we call it as Yoga Anusandhana Samsthan, we have been working on various areas of applying yoga in the medical profession.
Today in the medical world, where there are a large number of ailments where medical science has come to a question mark, and where medical science can only suppress diseases but can't provide a cure to the same. The yoga philosophy believes not only in helping people to come up from sick state to the state of normal health, but also move to higher and higher level of health, that is, promotion of positive health. But the question is how?
What we normally find in these ailments is that there is this basic common component of the stress as the basic fundamental cause, even in a disease like asthma. You can see here that this was a study that was conducted in bronchial asthma patients. We took up two groups of bronchial asthma patients. 53 of them were doing yoga, 53 of them were not doing yoga, and we wanted to study what happens if they did yoga, and we taught them yoga over a period of about 15 days to 1 month, and they went on continuing to practice for about an hour every day. And we noticed that when we were following them up for about 3 to 54 months, their capacity to overcome their asthmatic attack was much better.
Another group of 570 people was made to practice yoga anywhere between 3 to 54 months in the age group of 7 to 75 years. Here, it can be seen that even the children with asthma can do yoga. The question is, what was noticed during this period of 3 to 54 months?
We noticed that you can see from the upper right bar diagram that the drug score had reduced highly significantly in the group who practiced yoga as compared to the group who did not practice yoga, and the dose of the medicines required had stopped almost in 80% of these patients within these 3 to 54 months of their follow-up. And the lower left portion of the slide shows that the lung capacity, their capacity to blow, what we call as peak flow rate, had increased quite significantly in the group who practiced yoga as compared to the group who did not practice yoga after this practice duration. Therefore, how does asthma work, or how does yoga work in asthma? We say it's been known to people who are working in the area of asthma that asthma is a condition where there is an internal hyperreactivity of the system. The body overreacts, the nerves inside the system, the parasympathetic nerves are so overreactive, so sensitive that they create imbalance. So by giving very, very deep rest over nervous system, by giving very deep stabilizing practices, yoga we say is samatva, balance, we bring about this imbalance and set right the balance so that the asthmatic attacks go away, as has been shown by the scientific data.
There are a few exercises in yoga which can be practiced even during acute asthma stages. This is known as chair breathing exercise. Here, the person hangs on to the chair whenever he has a severe attack.
When the beginning of an attack, he pulls a nearby chair and keeps it as a support so that he is fairly comfortable in this position. When a person has severe asthma, he will not be able to breathe comfortably if he lies down, and therefore we give the support of the chair and we start asking the person to breathe in as he goes up and breathe out as he comes down, and this continues for some time with continuing relaxation suggestions of slower and slower and slower breathing. And it is very interesting to see how even in severe spasm, when the air passage is narrowed and the person is finding it very difficult to breathe in and out, he will be able to overcome the attack, and we did some studies on that also.
This is a group of anxiety neurosis patients. 19 of them were subjected to yoga practices, and it was noticed that they were all having enormous tension, lot of anxiety, fear, restlessness, and they were even having diarrhea. All these patients were further taking up regular medicines.
And we taught them simple pranayama practices, and we also tell our patients, look, anxiety, neurosis, or what you are suffering from is not really a big disease. What you are really doing is, all of us feel anxious. Even normal people have to have anxiety to be able to carry on with our normal activities. If you are walking on the street and if you happen to come across an accident situation, if you don't get anxious, you will not be able to get away from the situation and help yourself. So anxiety is a normal, healthy reaction of our system, our body. But in your case, for unnecessary events, for small little events, you are getting too anxious. So that's what this diagram shows. If you plot all people, about hundreds of people in the society, most of us fall within the normal range of anxiety, and some of us a little more anxious, maybe on the right side of the graph, and therefore whatever our yogic techniques were taught for this emotion stability, controlling the mind, mastering the mind, techniques that we use to move from our normal levels of anxiety towards the left of the curve, where we become more and more stable. The same thing can be used for persons who are very anxious to come back to normal levels, and this is what we noticed in our study. We noticed when they practiced this sectional breathing, Nadi Shuddhi, Ujjayi, Shitali, Bhramari practices, they were able to feel a lot better, and we recorded various parameters. You see at the lower part of the curve, the Max Hamilton anxiety rating scale was measured, which measures the degree of anxiety, how anxious the person is. And when they were measured, we noticed that 4-week data and 8-week data, there was highly significant reduction in their anxiety level. Their urinary VMA, which is a measure of the excretory product in the urine of the blood, adrenaline. You all would have heard that anxiety means adrenaline, or in other words, when you are angry, you say, no, it's my adrenaline that is making angry, but it is the other way. When we are angry, we produce a lot more adrenaline, and that gets excreted in the urine, and that is what we measured. The VMA was measured, and we noticed that there was significant reduction in the VMA levels. At the top of the curve, we also noticed that GSR, which indicates galvanic skin response, which means that the level of sweating has reduced. If the GSR is high, the imperceptible sweating of the hands has reduced. That's what it indicates. So this is a very simple but interesting observation to show that the level of anxiety can reduce, and these are some of the objective data.
Do we have some role of this yoga in curing this diabetes? Like we have listened about this diabetes, is that it is a type of disease in which the pancreas are secreting less insulin, or they are not working. So do you consider it as a psychosomatic disorder? If yes, then how does yoga comes into play?
Yeah, you're right, in the sense that diabetes now has quite well been established that it is a genetic disorder. The gene has been isolated. In fact, the research is going on where people are going to do some genetic engineering to cure this disease. At the physical level, this is going on. But even in a disease like diabetes, yoga has an important role, as we can see here, to be able to maintain a normal blood sugar at the level required for the system between 100 to 150 blood glucose levels. There are two sides of the balance, the insulin on one side and the other hormones like glucagon, stress hormones, particularly the adrenaline, cortisol, which try to increase the blood sugar levels. So if insulin is inefficient or insufficient, as we see in diabetes, then we have to be very careful to handle our insulin. We have to be very economical with our insulin. Whereas if you overstress yourself and produce lots and lots of amount of adrenaline, cortisol in our blood through stress, the weight on the other side of the balance increases, and to balance that you need lot more insulin, and that extra demand of insulin you are not able to supply. So that is the role of yoga, where it is a deeply relaxing technique and helps in stabilizing. And we also add certain exercise effect type of yogic practices which we call as dynamic yogasanas, which helps in utilization of the extra glucose that is there, similar to the exercise effect. In fact, we say that exercise is a friend of insulin on this side of the balance, and relaxation, calming down of the mind, resting like shavasana, pranayama, etc. help on this side of the balance, both helping them through control of the mind to be able to stabilize their blood sugar levels.
A study was conducted at the Royal Frey Hospital in London, where a certain exercises of asanas and pranayam was taught to a group of people with yoga, while the other group was not exposed to yoga. And it was found later on that the doses of drugs required was reduced quite significantly, and the blood sugar level had also reduced in the group who did yoga.
Another very interesting thing that we noticed was the reduction in the glycosylated hemoglobin, or HbA as we call it, which shows the long-term control of diabetes. Over a long period of time, the diabetes can be kept under control if one starts practicing asanas, pranayama, etc. They are quite simple practices also. Another interesting area where, of course, lot of work has been done is the area of hypertension.
As early as 1960, Dr. Date was able to show that Shavasana has an important role in the management of mild hypertension.
In the modern day living style, we are using this response system so frequently without giving enough time for the system to return back to normalcy, that repeatedly 100 times in a day the blood pressure is up and down, up and down, up and down. And after 20 years of this stressful lifestyle, the system says, "Arey, come on, why should I go down? Let me remain high, you carry on doing your activities." And we go to the doctor. Doctor says, "Come on, rest on the couch. I want to check your blood pressure when you are relaxed." But the BP does not go down. So this is the habituation of the nervous system to be working at a particular speed, response, and the nervous system forgets to bring the blood pressure back to normal. The arteries around, the blood muscles around the arteries are so much tight and continuously stimulation that they are forgotten to relax. So what we try to do is to teach them yogic techniques where they calm down the mind, give very, very deep rest to the nervous system there, so that the blood vessels also relax and the BP starts coming down.
Heart attack is considered to be one of the most fatal disease in modern day hectic life. Can yoga provide an answer to this disease?
Heart attacks is the second major killer after accidents in the whole world today. So this disease, which is going on increasing in its incidence, larger and larger number of people are dying because of this, suffering because of this, a big challenge to medical profession. Yes, we have met this challenge by technological advances, such fantastic technological advances. We can even remove the blocked arteries around the heart and replace it, the famous bypass surgeries that we are all hearing about. But what is the root cause? The root cause of the disease is there within our system. There is a risk factor which you can see. These are the 5 major risk factors for heart attack: cigarette smoking, high cholesterol, obesity, diabetes, and stress. But if you look at each one of these, a person smokes heavily. Why? Because he is stressed. He does not control his diet, therefore his cholesterol goes up. Why? Because he cannot control his desires to eat and eat more and more junk food. So the cholesterol goes up. Obesity, because again he cannot control his mind. Diabetes uncontrolled, therefore he cannot control. Therefore stress is a very, very important role, and that's what is called as lifestyle change. So yoga is a very important role in the prevention of these ailments and helping in these ailments.
In the next part of this program, we shall be discussing the role of yoga in a few other diseases, as well as a few methods of doing yoga with reference to particular diseases.